Hello friends. So today I'm going to briefly talk about the impact that this year's budget could have on the healthcare sector. So I'm sure there are many other announcements which you all may be interested in, but I'll focus only on the parts of the budget that impacts the healthcare sector directly. So the first major announcement was setting up or increasing the number of medical seats by about 10,000 in this year in the next 1 year and 75,000 medical seats in the next 5 years. So definitely it is a very welcome move because we know that the doctor to patient ratio in our country is less. So we need more doctors, so that will increase the access or improve the access of doctors for the patients and reduce the waiting time. Now some critics may say that we do not have the infrastructure, we may have shortage of faculty, the facilities in medical colleges. I agree with all those points. So definitely the government also has to ensure adequate number of faculties, and also the infrastructure and facilities at medical colleges should be improved. And the second part is also that once the doctors get trained, then they should be encouraged to work in needy areas, because we know that there is concentration of doctors in metro cities or bigger cities, and in the smaller towns or even in rural areas there is still relative lack of doctors. So that is another area to look at. The second one is the setting up of daycare cancer centers, and we know that cancer is one among the top three leading causes of death and disability. Other two are heart attack and strokes. So definitely setting up of cancer care and daycare cancer centers in district hospitals, it is a welcome move, so that can help in screening, early diagnosis of cancers, and therefore it can help in treatment of cancers also. And the third one is this budget, the allocations to add more number of life-saving medications to the list, and also medicines with lesser duties have been added. So in all, about 37 medicines and 13 new patient assistance programs have been added. So this can help in treatment of rare diseases, cancers, and also many chronic conditions. And then the next point we look at is the allocation of budget for this year, which has been increased to 98,311 crores, which is about 8.4% higher than last year budget allocation for the healthcare sector, which was at about 90,659 crores. So increase in the budget allocation for the healthcare sector is definitely a welcome move. Of course, there is no end to it. We need more and more allocations, because if you look at our total GDP, still there are many other sectors which require maximum more budget than healthcare sector. So relative expenses on the healthcare sector is still less, which needs to further improve in the future years. And then one more interesting point we heard about is the setting up of Makhana board in Bihar. Now many of you may know Makhana, but many of you may not have heard also. So Makhana is highly nutritious snack, and you'll be surprised, or you'll be pleasantly surprised to note that about 90% of world's Makhana is produced in Bihar. And it is a very healthy snack which is high in proteins, low in carbohydrate, has low glycemic index. It also has some minerals like iron, calcium, and potassium. So it can be useful for healthy people as well as those who want to maintain weight or go for weight loss, or diabetes and hypertension patients also. So let us hope that for the general public, cost can improve or cost can reduce, and for the farmers they can get fair price for the Makhana also. And then the last point is about medical tourism. So in this budget there was an announcement that the government would facilitate medical tourism, so they will try to increase the access or the facilities at various hospitals for foreign patients. And also we heard in the budget that about 120 new airports also may be added, and the facilities for granting easier visa for tourism, including medical tourism. So all these things could be a good news for hospital and pharma industry. So in all, I think if you look at the current budget, definitely there are many good points about the healthcare sector, and let us hope that these announcements, whatever have been done, they are fulfilled and in the right manner, so that overall health of general public can improve.